Hello, I'm Senator Nancy Cassis, and welcome to your Lansing Connection. As you know, I reside in Novi, but have the distinct, wonderful opportunity to represent most of western Oakland County in the state Senate. And as usual, we try to bring to you some very interesting people who are making things happen. And today we really have an exceptional individual who is making things happen. He's a very good colleague of mine. His name is Senator Tom George. He hails from Kalamazoo, and he is a physician with a great deal of expertise in the medical field. And I was very pleased to have him join us today because, as all of you know, the cost of health care and the ability to access health care has become one of the major issues facing all of our citizens, no matter where you live. So I'm very pleased to welcome Dr. Tom George. Welcome to our program.
Thank you, Senator Cassis. It's a pleasure to be here. And as you mentioned, I represent the Kalamazoo area, so the other side of the state, but we all work together trying to find ways to make Michigan better. And when you mention, the cost of health care, this is one of the biggest challenges facing us today. If you look at the state budget or our local school budgets, certainly in my district and probably in yours, if you look at university budgets, I have Western Michigan University, they will tell you, and you will see, that the health care cost is the fastest growing piece. And in regards to the state budget, as we spend more and more on health care, that leaves less and less for other priorities. So health care spending is diverting money from, say, fixing roads or money that could go to our schools or our universities or for police protection. And then if you look at private businesses, they'll tell you the same thing. General Motors will say, the automakers will say they're having trouble competing with the foreign car makers because of the cost of healthcare. They say now that healthcare adds $1,500 to $1,700 to the price of every vehicle. So it's private businesses, it's school districts, it's local governments, it's state government, it's the federal government. How can we control healthcare cost? How we answer that question is going to be very important in determining the course of our economy in the coming years.
Tom, I think you've outlined what the problem is, and as we go home to our districts and meet our constituents, say at the local Big Boy, or run into them at the cleaners, or where we go to get our car repaired, wherever we go, we're hearing this level of anxiety. If individuals still have a job here in Michigan because the economic downturn has been severe, they're still talking about what happens if my job, it is lost. What happens? And then they immediately talk about health care to my family, to myself. That seems to be one of the biggest fears of all, if I lose my health care. So really nothing is more important when you look at the whole scheme of things than what you're talking about. And right now, you are in the midst of what I would say one of the most important issues facing Michigan. As chair of health policy, you are dealing with some bills that are really designed, perhaps, to look at the question of access and affordability, and how you're going about this becomes very critical. Tell us a little bit.
Sure.
How was it that this, right now, here and now, got started as a major issue, and where we're in this, and you're doing some remarkable hearings, I know. Please just share with us.
Well, one of the things to keep in mind, and you mentioned it, Nancy and Senator Cassis, you have, I think, a very good understanding here of a lot of the principles that are facing us. And it's good to have you as a partner in this. And if we can keep in mind the goal, which is to have health care be affordable and accessible, if that is our goal, And our further goal, and it's actually given to us in the state constitution, it says the legislature shall pass laws to promote the health of the public. If we can keep those things in mind, we want health care to be affordable, accessible, and we want people to be healthy. And that is our bar or our measuring stick to measure legislation that comes before us.
And if
we'll be on safe ground.
If I could, you've been in the forefront of that, and I want all of our listeners and people watching to know that. You have consistently talked about healthy behaviors as a prevention against later illnesses that become much, much more costly. And that you and I are very, very much in agreement about doing things that promote behaviors that in the long run are going to be good for you. And to that end, you've been a leader. And that all figures into what you're doing now. It
all interconnects, because what we have found is if you look at these rising healthcare costs, why are they going up? Why is it $1,700 to the price of every car? Why is the Medicaid budget that we oversee, the state budget, why is the Medicaid piece growing so fast, and again, taking money from maybe other priorities? Why is it? If you look at that, what you'll see is that it's utilization. It's not that the payment for any specific service has risen, it's the number of services. So for example, cataract surgery has become very commonplace. The amount that, say, is paid for a single cataract operation may have decreased some, but the number of cataract surgeries has grown so much that the net cost has grown. And the same can apply to many, many medical services. It's the volume that is rising. And why is that? Well, it's a couple things. One is we're an aging population. As we age, the tendency is to use more medical services. The second is that there's new things being invented. There's new medical technologies, things like total knee replacements and total hips and implanted pacemakers and defibrillators. Those have come into the fore in the last couple decades. So we have new technology, and they largely work well. So again, if you have a knee replacement, you'll probably come back in a couple years to have the second knee done, so it's the volume is increasing. But the third factor, and the one that we really do have control over, is this utilization reflects our behaviors. And some people think that behaviors account for as much as 70% of healthcare costs.
It's enormous.
It ranges from, depending on what study you look at, 30 to 70%. And what am I talking about? What do I mean behaviors? Well, I'm talking about things that we do. Now, I'm not talking about conditions that we're born with. I'm talking about things we have control over, like if you ride a motorcycle, do you wear a helmet? Do you buckle your seatbelt? Those are behaviors that affect the likelihood of using health services later. And the most important behaviors that affect cost are smoking, exercise or lack of, and then completing health screenings. Those are the big three. And health screenings, I'm talking about things like getting your cholesterol checked, having a colonoscopy when you reach age 50, having mammograms, at certain ages if you're a woman, having your blood sugar checked, being screened for diabetes. These are behaviors, whether you in fact did that or not. So it's these behaviors, smoking, exercise, completing health screenings, those account for a huge amount of utilization and health care cost later.
And those, for example, if you quit smoking, if you start walking, no special equipment needed.
Yep.
I need to do more of that. I know
Well,
I do.
we all need to. And this gets to the point that in Michigan, we have a lot to gain, because if you compare us to other states, our health behavior is poor. I'll give you a couple examples. We smoke more in Michigan than our neighbors in other states do.